Primaquine. Primaquine is an anti-malarial agent. It belongs to 8-amino quinoline. It is a synthetic 8-amino quinoline. It is effective against hepatic stages, that is, primary and latent tissue forms of Plasmodia species that infect human. Primaquine, it is a synthetic 8-amino quinoline. It is effective against the hepatic stages, that is, primary and latent tissue forms of Plasmodium species that infect humans. It also has marked gametocidal activity but is ineffective against the erythrocytic forms of malarial parasite. So it has marked gametocidal activity. Primaquine has marked gametocidal activity, but it is ineffective against the erythrocytic forms of malarial parasite. Malarial parasite के erythrocytic forms के लिए ये ineffective होता है. The exact mechanism of action of primaquine is unknown. It probably acts by generating reactive oxygen radicals and interfering with the mitochondrial electron transport in the parasite. So primaquine, it acts by generating reactive oxygen radicals and interfering with the mitochondrial electron transport in the parasite, that is plasmodium. ये reactive oxygen species को generate करता है and it interferes with the mitochondrial electron transport in the parasite. It is almost completely absorbed after oral administration, widely distributed, metabolized in liver, and excreted slowly in urine. So, route of administration oral, completely absorbed, widely distributed, and metabolized in the liver and excreted slowly in the urine. Primaquine is used for radical cure and terminal prophylaxis of Plasmodium vivax and Plasmodium ovale, as it has strong activity against hypnocytes. ठीक है. So the question comes that Plasmodium vivax में Primaquine को क्यों यूज़ करते हैं. तो Primaquine is used for the radical cure and terminal prophylaxis. Radical cure and terminal prophylaxis of Plasmodium vivax because it has strong activity against the hypnocytes. It has strong activity against the hypnocytes. For terminal prophylaxis, Primaquine 50 mg daily is started slowly before or after return from the endemic area. So prophylaxis के लिए Primaquine 15 mg daily is started shortly before or after return from a endemic area. Prophylaxis के लिए 15 mg daily देते हैं. For radical cure of relapsing malaria, for radical cure of relapsing malaria, that is Plasmodium vivax and Plasmodium ovale, 2-week course of Primaquine is given concurrently with chloroquine or after the treatment of acute attack. Radical cure of relapsing fever के लिए 2 week course of Primaquine is given concurrently with chloroquine. 2-week course of Primaquine is given concurrently with chloroquine or after the treatment of acute attack. Adverse effect, this includes nausea, vomiting, epigastric distress, can be minimized by taking it with food. Adverse effect में nausea, vomiting, epigastric distress, nausea, vomiting, epigastric distress. These side effects can be minimized if it is taken with food. The important side effects with Primaquine is hemolytic anemia in people with G6PD deficiency. G6PD deficiency वाले individuals में it causes hemolytic anemia. Okay. Methemoglobinemia can also occur with Primaquine. Methemoglobinemia can also occur with Primaquine. It is contraindicated in pregnancy. Tablet Primaquine phosphate 26 milligram contains 15 milligram base of primaquine base. So primaquine belongs to 8 amino quinoline. ठीक है, ये हेपाटिक स्टेजेस के लिए इफेक्टिव है. इट हैज़ मार्क्ड गैमेटोसाइडल एक्टिविटी, ठीक है, बट इट इज़ इनइफेक्टिव अगेंस्ट द एरिथ्रोसाइटिक फॉर्म ऑफ मलेरिया. Mechanism of action क्या है? It probably generates reactive oxygen species and interferes with the mitochondrial electron transport in the parasite. Okay, it is used for radical cure and terminal prophylaxis of Plasmodium vivax and Plasmodium ovale. Radical cure के लिए भी और terminal prophylaxis के लिए भी. Why? Because it has strong activity against the hypnozoites. So primaquine has strong activity against the hypnozoites, and so it is used in radical cure and terminal prophylaxis of Plasmodium vivax and Plasmodium ovale. Prophylaxis के लिए primaquine 15 milligram daily is started shortly before or after the return from endemic area. और radical cure के लिए 2-week course of primaquine is given concurrently with chloroquine. 2 week of primaquine is given with concurrently with chloroquine or after the treatment of the acute attack. के एडवर्स इफेक्ट्स में G6PD डिफिशियंसी वाले पेशेंट्स में इट कैन कॉज हीमोलाइटिक अनीमिया, इट कैन कॉज मिथ हीमोग्लोबिनीमिया, इट इज़ कॉन्ट्राइंडिकेटेड इन प्रेगनेंसी.